This is Dr. Caudill Miller or Dr. Miller's Guide for Neurology. We've been talking about headaches and specifically anticonvulsants for headaches. Today we're going to talk about Kepra. Kepra and Topamax are by far my favorite anticonvulsants to use for headaches, and Kepra is very safe. We use it a lot in young people. We think it's probably even safe in pregnancy, so we use it in women of childbearing age. Very well tolerated. Start at very low doses, 500 milligrams once a day, and then work up to 500 twice a day, up to 1,500 milligrams twice a day. Very few side effects. Drowsiness is the main one. Most people have no side effects, but there's one sort of idiosyncratic side effect with behavioral change, which is very bizarre. They can be paranoid, very irritable, irrational. Anxiety can be aggressive, not sort of like violent aggressiveness, but very bizarre thoughts. I remember being told this when it first came out, and I really remembered it after the first patient I saw that had it. This was sort of a Clark Kent guy, and I put him on Kepra, went home, and months later, his wife sent him to the grocery store for milk and cream. He goes to the post office, gets in a big fight with the postmaster. His wife calls. All of a sudden, remember, this could be Kepra. He came in, and he was definitely the wild-eyed, wild man syndrome, which is what they call this. I mean, he was bug-eyed and stopped the Kepra. Within a week or two, he was back to normal. So I never forgot that. So I always tell people about this. You don't want to scare someone about a drug, but very similar to that situation, she really thought over time he was getting a psychiatric disorder. It was really the medication. So in a really bad year, I'll see this 2 or 3 times a year. And so you just really need to tell people about this side effect. But Kepra is a great anticonvulsant we use for headaches and epilepsy. So that's Kepra. Well, subscribe to my channel, make some comments, and more later.